Thank you for attending this webinar on acupuncture and massage therapy, billing and coding. Just a quick disclaimer before we get going. The information in this webinar is for educational purposes. It's not intended to substitute your clinical decision making. It's not intended to substitute your billing protocols. It's not intended to be legal advice. Target Coding does not provide legal services. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information in this webinar is 100% accurate. However, it's not guaranteed. We have a lot of people listening to this webinar this morning. Some of you are past attendees of our webinars and seminars. Some of you are members of Target Coding, and some of you are brand new to my company. So for those of you that have no idea who I am, let me tell you a little bit about myself. Again, my name is Dr. Marty Kotler. I am a chiropractor. I practiced for 16 years prior to starting my company, Target Coding. I am also a certified professional compliance officer and certified billing and coding specialist. That's what all those letters are after my name. My area of expertise is in coding, billing, cash practice compliance, documentation, risk management, durable medical equipment, medical errors, record keeping, Medicare, and HIPAA. And I consider myself kind of unique. Let me tell you why. Most doctors are not certified coders. Most certified coders are not doctors. So you'll see during this webinar how I combine both specialties to help you improve productivity, maximize reimbursement, reduce administrative burden, and show you how to get paid for everything you do. Target Coding has been helping thousands of doctors and their staff members for over 15 years with our exceptional products and services. Now, those of you that are Target Coding members, if you would like to get the playback recording of this webinar, just log into your account. Give us 24 hours and we're going to upload this video into your account so you could watch it just in case you don't make it through the entire webinar, or you have a staff member that was not able to make it in today and you'd like to get the playback recording. You could also get the forms that I'm going to be showing you and the PowerPoint slides. So these items, they'll be waiting for you once you log into your account. Also, Target Coding members, you could also receive a certificate of attendance. You should see a screenshot of this certificate of attendance that we give to our members. And we recommend you place your certificate of attendance in your billing and coding policy manual. Use the certificate of attendance as proof. Just in case the coding police come knocking on your door, use this certificate of attendance as proof that you take billing and coding seriously and you care about preventing fraud and abuse. Any questions so far, email info@targetcoding.com and one of our staff members will get back to you right away. Okay, let's begin with acupuncture. Acupuncture, billing, coding, and documentation. Forms, yes. Your acupuncture patients will need to fill out forms. Here's a list of Target Coding forms. You probably don't need all these forms, but you should have a general new patient health history form. The one on the right is specific for acupuncture. It asks certain questions. Next, make sure you have a good quality HIPAA notice. Review your forms. Every year, you should do a complete forms scrubbing. See if there's any updates needed to your forms. This is our sample HIPAA form. Make sure you have a good quality HIPAA form. It should be posted. You can give everyone a copy of your HIPAA notice, but you don't have to do that. Now, you have to have a form that the patient signs that they have the opportunity to get a copy of your HIPAA notice. So you could display it in your waiting room. If you have a television monitor in your waiting room that loops chiropractic messages, you could have your HIPAA notice scrolling across the screen. Next form, informed consent, consent to treat. Yes, this form relates to the possible complications to your services. Acupuncture, chiropractic, every medical service, chiropractic service has a possible complication, although very rare. So this form directly relates to malpractice. So there's a sample informed consent specifically for acupuncture. So check with your malpractice insurance company on what form to use. You know, hopefully you're never involved in a malpractice case, but if you are, this is the first form the attorneys are going to want to see. They are going to want to know, what did you tell the patient could possibly happen from the service? One more form, it relates to the No Surprise Act or No Surprise Law. You are required to give patients something called good faith estimate. Basically, in chiropractic, this is where I'm putting on my chiropractic hat. It's a financial care plan. This is for services that are not covered by insurance. Patients need to be told how much things are going to cost prior to the service being provided, and your estimate needs to be within $400. So the No Surprise Act has been around for a while. It became a law in 2020. It became effective in 2022. So here's a sample good faith estimate. Financial care plan, pretty much the same thing. What I recommend is take a look at your financial care plans that you give to your cash patients, uninsured patients, out-of-network patients. Take a look. Does your form have your NPI number, tax ID number, and the diagnosis on it? You're probably going to say, no, it doesn't have all those three things. How do I know that? I've reviewed thousands of financial care plans over the past 15 years. So I know what they look like. So those three things should be on your financial care plan forms, or otherwise known as the good faith estimate, NPI number, tax ID number, and diagnosis. Now, some of you may be saying, I don't understand. Why do we need those three things? My response is, I don't understand it either, but I don't make the rules. I just enforce them and explain them. So here comes Mrs. Smith. She wants acupuncture. You provide acupuncture. Now, many doctors of chiropractic are dual licensed. They're chiropractors and acupuncturists, or in many instances, the chiropractor employs an acupuncturist to be part of the office. Now, in some states, chiropractors cannot employ an acupuncturist unless the chiropractor is also an acupuncturist, so check with your state board rules. Here comes Mrs. Smith. She needs acupuncture. She is going to get a treatment plan. History, exam, diagnosis, goals, and then the acupuncture services and any other services. So there are some insurance companies that cover the exam. So let's go through the history and the exam. Pretty much straightforward, history, exam, and now in order to bill for the history and exam, you need to have good documentation. The documentation guidelines were updated a few years ago, and now they're based on two key factors. So we're talking about new patient codes 202 through 205 and 99212 through 99215. You should be familiar with those CPT codes. I'm not going to get into too much detail into those codes. We have other webinars that we offer that we go into detail for those. So yes, there are some insurance companies that will cover acupuncturists for those new patient codes and re-exam codes. So make sure you understand the two key factors that are required. It's actually one or the other, time or decision making. And this is based on an initiative that the federal government put out a few years ago. It was called Patients Over Paperwork. This caught my interest. And the purpose of this initiative was to reduce administrative burden placed on doctors and staff members. Yeah, that's a good thing. And also allow healthcare providers to get paid for every minute they're with the patient. So because of this initiative, the American Medical Association had to update the documentation guidelines for new patient codes and re-exam codes. What you see on your screen now is a cover page to the guidelines. If you would like a copy of these guidelines, send an email to info@targetcoding.com. So the time factors you should see on your screen. I have the two most common highlighted in blue, 99203, 30 minutes, 99213, 20 minutes. And the time component includes reviewing MRIs, reviewing records, reviewing tests, reviewing notes from other acupuncturists, documenting the encounter, speaking to other healthcare providers. Many things are included with the time component, which were not included in the old guidelines. If you don't use the time component, then use the decision-making component, MDM, medical decision-making, and that's based on three elements. If you've been to my seminars and webinars in the past, you know how I go through these in detail. I'm not going to go into it too much today. The three elements of decision-making are number one, the amount of problems, number two, the data to review, and number three, the risk level. So if you get a copy of these guidelines that the AMA put out, there's this beautiful chart that guides you through. It's like a breadcrumb trail. It guides you through the requirements in order to bill your proper new patient codes and re-exam codes. Now here are the acupuncture CPT codes. Here we go, 97810. Acupuncture, one or more needles without electrical stim. Initial 15 minutes of one-on-one contact with the patient. Terrific. Next, 97811. Acupuncture, one or more needles without electrical stim. Each additional 15 minutes. So if you spend 30 minutes with the patient, you'll bill 1 unit of 810 and 1 unit of 811. If you spend 60 minutes with a patient, a new patient would be 810 for 1 unit and 3 units of 811. Same logic applies with 97813 and 97814. This is acupuncture with electrical stim. 97813, initial 15 minutes. 97814, each additional 15 minutes. You always want to verify coverage prior to billing. Now, there are HCPCS codes for auricular acupuncture, S8930. That's a HCPCS code. Electrical stim, auricular acupuncture points each 15 minutes, one-on-one with the patient. We do have some acupuncturists that want to charge patients for the needles. So we have HCPCS codes for the cost of the needles, A4212. Those are use of non-coring stylet acupuncture needles. A4215, use of sterile needles. The acupuncture codes include a pre-assessment, intra-service, and post-service assessment. So basically, the pre-service is greeting the patient, the intra-service is doing the procedure, the post-service is charting and entering instructions into the chart that you gave to the patient. Here's more details of what the time component would include. One-on-one contact with the patient. So you're reviewing the patient's chart, discussing the patient's results from the last treatment. Many acupuncturists will look at the pulse, tongue, skin, ears, selecting the appropriate acupuncture points, inserting the needles, manipulating the needles, removing the needles, reinserting needles, disposing of the needles, counseling and coordinating future visits. Now, does insurance cover acupuncture? Yes, no, maybe. As I mentioned, you should contact the insurance company. If you're expecting the insurance company to pay, it's a good idea to contact them or get your hands on their policy. So here comes Mr. Taylor. He needs acupuncture treatment. He's a candidate for acupuncture treatment. He has Aetna. Okay, here's Aetna's policy on acupuncture. Make sure you understand the details. Aetna considers acupuncture medically necessary for chronic neck pain, chronic headaches, chronic low back pain. The threshold is 12 weeks, at least 12 weeks. If the patient is complaining of low back pain for 2 weeks, Aetna doesn't cover acupuncture in that case. So it gives you details on what they considered covered, what conditions they consider not covered. Very long list of services or conditions that they consider not covered. And this is great. You could show this to a patient. If the patient has, let's say, fibromyalgia and wants and is desiring acupuncture and has Aetna, you could say, Mr. Taylor, let me show you this. This is directly from the Aetna website. It says that they do not cover acupuncture for the treatment of fibromyalgia. I just wanted to show you this. You can contact Aetna for more information. So at the present time, we're going to treat you as if you're a cash patient. That might be upsetting to the patient. However, you're just following policies. By the way, whenever I do my live seminars, oftentimes on the breaks, chiropractic assistants will come up to me and ask me, how do you become certified in coding? How do you learn all this stuff? You'll have to buy a whole bunch of books. If you want to become certified, you'll need to take a test. I need to get 36 hours of CEUs every 2 years for my certification in compliance, 24 hours of CEUs for my certification in billing and coding, another 36 hours for my chiropractic license. So I'm always taking a lot of courses, reading all these manuals, staying up to date, This is the Medicare policy on billing and coding for chiropractic. I also contact many chiropractic state boards. Many of my clients, they want to remain anonymous. I have a client in North Carolina. He wants to provide free chiropractic exams. So I wanted to contact the state board to see if it was okay. Another client of mine from Texas wants to provide shockwave therapy, wants to make sure it's within the scope, who can provide it. So I contact state boards on behalf of my clients. I also read malpractice carriers' journals and newsletters, staying up to date on how to prevent malpractice cases, risk management. I get emails from the OIG letting me know which doctors have been convicted of insurance fraud, all these different healthcare providers. I want to stay up to date. I want to make sure I share this with the entire chiropractic profession to make sure you know how to avoid these problems. Here's the owner of a billing company sentenced for healthcare fraud. Chiropractor sentenced to 7 years in prison for healthcare fraud. These are horror stories, but this is the way you learn. I don't teach from scare tactics. I teach from education. Okay, let's move on to massage therapy. Massage therapy, initial visit. Also, we're going to have forums. Massage therapist is going to treat your patients. You may want to have separate forms for massage therapy. There's one on the left. That's a specific massage therapy health history questionnaire that I created. These are all part of a package of every form that you see scrolling across your screen comes from Target Coding's package of forms, logs, fightback letters, templates. They're for sale. Just go to Target Coding website. You could purchase all of these forms. Level 3 members, these are included with your membership. So massage therapy has an initial consultation with the patient, also does an exam. Now, check with your scope of practice, check with your licensing board. Is it okay for in your state to employ massage therapists? I'm pretty sure every state in the country allows chiropractors to employ massage therapists. Now, your massage therapist, you may want to get separate liability and malpractice insurance. If billing insurance, call to verify coverage prior to billing. Some insurance companies do not reimburse for massage therapy. Now, there is a difference between medical massage and wellness massage. Medical massage is probably paid by insurance because they will consider it medically necessary. Wellness spa type massages are typically not payable by insurance because they don't consider that service medically necessary. The CPT code for massage therapy is 97124. That includes effleurage, petrissage, tapotement, stroking, compression, percussion. That's one or more areas each 15 minutes. Let's go over a couple of things. It says percussion. Some of the doctors we work with use handheld instruments like the percussor, the arthrostim. If you're going to bill for that type of a service, my recommendation is to use this code 97124. Now I said each 15 minutes. Here's some really good news. In order to bill 1 unit of 97124, doesn't have to be 15 minutes. It could be as little as 8. I'm going to go over timed units billing in a few minutes. So massage is used for a reason. Everything you do should have a clinical indication. If you've been to my seminars and webinars in the past, you know how I stress the importance of providing the clinical rationale for everything you do. If you have a question, you're on the witness stand. Hey, Dr. Kotler, why do you do massage therapy on patients? Well, we do it to restore muscle function, reduce edema, improve joint motion, reduce spasm. Great answer. Use it as a preparatory procedure on the same day as a therapeutic procedure. Now, at the bottom of the slide, you see the last bullet point, CCI edit. We'll get to that in a minute. This code has a CCI edit. That stands for Correct Coding Initiative Edit on the same day as an adjustment. Next code often used by massage therapists is 97140. That's manual therapy techniques. That it could include one or more of the following: soft tissue mobilization, joint mobilization, Manipulation, manual lymphatic drainage, manual traction, not mechanical traction, manual traction, and myofascial release. What's the clinical rationale? One of them is to stretch, shorten connective tissue. This has a CCI edit. So now let me go over the CCI edits. This is one of the rules where I shake my head and I say to myself, I don't understand. I don't understand. I don't get it. And then I shake my head again and I don't make the rules. I just explain them. 97124 massage and manual therapy cannot be done in the same region as the adjustment. If you want to get paid for manual therapy, it has to be in a separate region. Same thing for massage and neuromuscular reeducation. So I consider massage therapy and manual therapy to be passive services. The patient is relaxing, not doing anything. The massage therapist is doing the work. When it comes to a modality like electrical stim or traction, that's also passive. Now, what's considered active? Therapeutic exercises, neuromuscular reeducation, therapeutic activities. In that case, the patient is doing the work and the healthcare provider is supervising the service. So here's a picture's worth 1,000 words. These are all active procedures: balls, bands, weights, tubes, wobble cushion, wobble chair. Okay, so Mrs. Anderson needs or is a candidate for massage therapy. Does her insurance cover it? Maybe. Does Cigna cover it? This is Cigna's policy. In many states, Cigna works with American Specialty Health, ASH. So this is Cigna's policy, along with ASH's policy, specifically on massage therapy. They have a whole section on it. Make sure you're familiar with this. Here's a common question we get. Dr. Kotler, we have a massage therapist working for us. Should he or she be an employee or an independent contractor? So I'm not an accountant. So this is just for educational purposes, just to share with you. If you are telling the massage therapist what days to show up, what hours to work, the massage therapist is using your equipment, your lotion, your oils, your table. That's an employee arrangement. Independent contractor, the massage therapist is making the appointments on their own, scheduling the appointments, bringing in their own table, lotions and oils, and you work out a compensation. Any questions on employee versus independent contractor, send them to info@targetcoding.com. Now, in my practice, I had a combination. I had times where my massage therapist was acting as an employee, and then if patients wanted to hire my massage therapist on an hourly basis during off-peak hours for spa type, non-insurance massages, then my massage therapist was acting as an independent contractor. So you could have both. Check with your accountant on that. Now, I mentioned each 15 minutes for massage and manual therapy. Good news is it doesn't have to be 15 minutes. It could be as little as 8. Look at the range. 8 to 22 minutes is 1 unit. Now, once you get to more than 1 unit, you need to use total time. So that's where it can get a little tricky. Massage for 8 minutes and then manual therapy for 8 minutes. You would think logically you should be able to bill one of each. Sorry, you can't. That totals 16 minutes. You see that example? Then you'd only be able to bill 1 unit. If you do 8 minutes of massage and 15 minutes of manual therapy, you total that up, that totals 23 minutes, then you could bill 1 of each. Same logic applies with 4 units here. Most of the doctors we work with for massage and acupuncture, it is cash-based. Most of the patients that come into your office have insurance, and because of the Affordable Care Act of 2013, every insurance company is required to have a chiropractic benefit. So when a patient walks into your office that has insurance, they know that their insurance has a chiropractic benefit. So they may think everything you offer, that is chiropractic, acupuncture, and massage, is covered. So when you tell them it's not covered, it could be a little bit of a surprise, but not a big deal for most practices to get patients to understand that they are responsible to pay. So if the patient is paying upfront for your acupuncture and massage services, give them a walkout receipt. We have tons of sample statements for full service fees, for Cairo Health USA discounts, or if you provide discounts, how to break it down on statements. These are very important. You should have the patient's date of birth, the diagnosis, the CPT codes, the diagnosis codes. If you want to wait for insurance to pay you, that's called accepting assignment. Do an insurance verification. What you see on your screen is Target Coding's insurance verification form. You don't have to use the form, but use the form to enter into your software program. Most of our clients don't use our paper forms, but they take the information from our paper forms and they include it into their EHR program. Every one of our forms, you can just copy and paste into your software. Here's a sample massage therapy soap note. It may look a little small on your screen, so if you want a copy of our sample massage therapy soap note, send an email to info@targetcoding.com. All right, we're rounding third, heading home. Just a few closing comments. Prevention is the key. Don't wait for the oil light to flash on your dashboard. The most important thing to do from a compliance standpoint, in my opinion, is to have policies and procedures on billing and coding and documentation. For example, have a policy on how your employees get trained on billing and coding. Have a policy on cash plans and patient discounts. Have a policy on deductibles, copays, and coinsurance. Is it okay to waive copays, coinsurance, and deductibles? The answer is maybe. I know most of you said, no, you can't do that. That was a trick question. There are instances where it is totally legal and okay to waive a copay or deductible or coinsurance. It's the routine waiver that's inappropriate. Saying something like this, all the police officers that come into the office, we're not going to collect the deductible. All the teachers that come in, we're going to waive the copay. That's inappropriate. And some doctors, they just want to be nice guys. Here comes Mrs. Johnson. She committed to a 36 visit care plan. She has a $500 deductible. We're just going to tell Mrs. Johnson, don't worry about the $500 deductible. We're going to eat it up. Yum, yum, eat it up. Because you're going to commit to 36 visits. We're going to use that deductible really quick so you don't have to pay it. So this chiropractor thinks he or she is being a nice guy. An auditor, an investigator doesn't look at it that way. You know how they look at it? They look at it this way. You took $500 cash, you put it in an envelope, and you just handed it to Mrs. Johnson. See, that's considered a kickback, and that violates what? The anti-kickback statute. Have a policy on that. Have a policy on background checks. Have a policy on documentation to prevent these crazy letters. Post-payment audit, $250,000 this doctor's being asked back for. Part of it is for acupuncture. Now we get good news. This is a doctor we worked with in South Carolina, had to send in notes, gets a letter back. After sending in the notes that we assisted him with, it says a review of the records you provided determined that they meet the requirements outlined in our policies. Therefore, this audit is being closed. No further action. Terrific. Break out the champagne. Here's another doctor. She has a very busy practice. She sees about 80 patients a day. We helped her with her notes. She sent in the notes. She gets this letter back. We applaud you on your billing accuracy. Wait, what? Right there in the letter. It says, we applaud you on your billing accuracy and we encourage you to continue your current billing practices. We found that all services submitted were reasonable and necessary. Great news. Oh, one of the most common questions we get at our help desk is, what software program do we recommend? We recommend Genesis by ClinicMind. You could scan that QR code to get more information on it. Some of the things we do at Target Coding include writing policy and procedure manuals, We also sell a book. I wrote a book on the best codes to improve reimbursement. It gives you the codes that pay for the most visits. You get cheat sheets emailed to you. Section 2 shows you how to pair your codes. So your CPT codes are what you're doing. Your diagnosis codes are why you're doing what you're doing, and they should pair, like food and wine, like peanut butter and chocolate. So we have a whole section on that. Section 3, we give you 25 of the most common chiropractic diagnosis codes and a little checklist, the subjective findings, orthopedic findings, the neurological findings, and the chiropractic findings to support your diagnosis codes. This book will help prevent insurance denials. What you can do, doctors, is take a page out of this book and use it as the topic of the day when you do your billing and coding training. You get the best PI cheat sheets emailed to you, best PI cheat sheets in the industry. This book will help you get paid better and faster. Other things we do webinars, we do live webinars on a regular basis. We have on demand. If you go to targetcoding.com, click on the on demand tab, you'll see our 25 webinars. That's our library. They're all up to date. We just finished our 6-part series helping CAs. It's called our CATS program, our CA boot camps, chiropractic assistant training series. Now, you could work with us on an hourly basis. We offer personal coaching to address your specific situations. We offer memberships, $99 a month, pay as you go. That's level 1. It includes all of our webinars. Each webinar is $99. We do 6 to 8 webinars a month, all included with level 1. I mentioned our forms, logs, templates. They're broken down into administrative, new patient forms, exams and treatment plans, a whole bunch of sample soap notes, letters of medical necessity. Get all of our HIPAA forms. We write HIPAA manuals. We do chart reviews. We do credentialing. We just had our seminar at C. How to become a concierge chiropractor is one of our programs. How to appeal repricing out-of-network claims. Now, we have tons of testimonials across the country. We have options to fit every practice. Please check with all the carriers you bill prior to submitting claims to ensure it's compliant. We can't guarantee this information will guarantee payment from any insurance company or patient. Target Coding is not responsible for any laws or rules that may change following this webinar, and you know they change all the time. So it's important to do your best to stay on top of the changes, attend seminars and webinars, join your national and state professional associations, follow us on Facebook, Instagram, LinkedIn, YouTube. I have over 100 free videos on YouTube. I just uploaded one on Shockwave billing, coding, and documentation. Here's my contact information. Email info@targetcoding.com, website targetcoding.com. Telephone number 1-800-270-7044. Yes, we still have doctors that like to fax us information. So we have a HIPAA secure fax number. That's 1-844-831-2347. If you'd like to set up a free practice analysis, you could scan that QR code in the bottom right corner. Or if you'd like to give us a call, send us an email. We're happy to set up a free practice analysis with you. So again, I want to thank everyone for attending. I hope you learned a lot. Take care, everyone. Bye-bye.